If I told you that fall didn't start the moment they hit the ground, that it started 10 seconds earlier, right there in their own bedroom, would you believe me? I had just finished a long overnight shift. They wheeled in an elderly woman on a stretcher, her face tight with pain, one leg visibly shorter than the other in a way I've seen often enough to recognize without an X-ray. Hip fracture. And when I asked what happened, her answer stopped me cold, not because it was unusual, but because I had heard it so many times before. She said, "I just stood up. That's all I did. I've been doing it the same way my whole life." I'm Sarah, and I've been an ER nurse for nearly 30 years. If I had to count, I've seen hundreds of older adults come through those doors with hip fractures. And I can tell you something that almost nobody ever hears. Roughly 80% of the hip fractures I've treated all started with the same mistake. A mistake so small that almost no one thinks of it as a mistake at all. It didn't happen on a staircase. It didn't happen on a slippery sidewalk or during a morning walk. It happened in the bedroom, in the morning, in the first few seconds after waking up. And in this video, I'm going to tell you exactly what that mistake is, why it's so dangerous, and more importantly, what you can do so that you never end up on that stretcher. Before I get into it, I want to ask you something. Leave me a comment below and tell me how old you are, and whether you tend to sit up fast in the morning, whether it's because of the alarm, because you need the bathroom, or just a habit you've carried since you were young. I read every single comment, and your answers genuinely shape what I cover next. And if you haven't subscribed yet, please hit that button now. Because every week I share things I've learned from working in the ER. Things that often don't get explained in a short doctor's appointment. Now let me describe the mistake I'm talking about, because I'm willing to bet that many of you watching this are doing it every single morning without knowing it. It's getting up too fast. The alarm goes off, or the urge to use the bathroom hits, and the instinct is to push straight up, feet hitting the floor almost the same moment you leave the pillow. It takes less than a second. For a 30-year-old, that's no problem at all. But for someone over 65, that single moment may be the most dangerous moment of their entire day. Let me explain why. The same way I explain it to my patients right there in the hospital bed. In plain language, no medical jargon needed. Think of your circulatory system like a massive network of pipes running from your toes all the way up to your brain. When you've been lying down all night, your body is horizontal, and blood is distributed fairly evenly throughout without having to fight gravity very hard. Your heart beats slower, your breathing is steady, and your entire circulatory system is in rest mode. The moment you suddenly stand straight up, gravity immediately pulls a large volume of blood downward toward your legs and lower body in just a few seconds. It's like taking a full bottle of water and flipping it upside down all at once. The water rushes down immediately. And in that moment, your brain, the organ that consumes the most oxygen in your body and cannot tolerate even a few seconds of reduced blood flow, suddenly gets less blood than it needs. What happens next? Dizziness, a swimmy feeling, the sense that the room is tilting, sometimes the feeling that your legs aren't quite steady beneath you. In medicine, we call this orthostatic hypotension, a drop in blood pressure caused by a change in position. But you don't need to remember that term. You just need to remember one thing. In the moment your brain is short on blood, even for just a few seconds, your body becomes extremely vulnerable to falling. And if there's nothing to grab onto, the floor is the next thing you'll meet. In younger people, the body compensates for this shift almost instantly. Blood vessels constrict, the heart speeds up, and within a fraction of a second, blood pressure is restored. But in older adults, that reflex slows down considerably. The valves in the leg veins, which act like small pumps pushing blood back up against gravity toward the heart, become less efficient with age. Arterial walls stiffen. The compensating reflex takes longer. The window of vulnerability stretches out, and that's the dangerous window. Now, I want to tell you something about why mornings are specifically more dangerous than any other time of day, because this is something I rarely hear explained clearly. After a full night of lying still, Your body isn't just dealing with the positional blood pressure drop, it's also in a uniquely vulnerable state. During sleep, you lose a small amount of fluid through breathing and perspiration, which means the blood volume in your body when you wake up is actually slightly lower than it will be later in the day. Lower blood volume means lower baseline pressure to begin with, so when you stand up suddenly, a system already running a little low is being asked to handle a sudden positional shock. Add to that the fact that your leg muscles, after a full night of inactivity, haven't been warmed up yet, and you have a perfect recipe for a fall. Many of my patients are also taking blood pressure medications or diuretics. I'm not going to go deep into medication specifics, because that conversation belongs between you and your doctor. It's not something I can or should advise on through a screen. What I can tell you, as someone who has stood in the ER and seen hundreds of patients, is that if you're taking those types of medications, you may notice the dizziness when standing more noticeably than other people. That's something worth bringing up with your doctor, not something to manage on your own at home. I remember one patient very clearly. I'll call her Dorothy. She was 72 years old, living alone in a small home outside Columbus, Ohio. Her children had grown up and moved away. Dorothy was a fiercely independent woman. She did her own grocery shopping, cooked her own meals, tended the small flower garden out front. The morning it happened, nothing seemed different. She woke up because her cat was crying at the door wanting to be fed, and she got up a little faster than usual, worried about disturbing the neighbors. She stood, took half a step, and then the room tilted hard to one side. Dorothy didn't remember exactly how she fell. She just remembered waking up on the cold floor, unable to move her right leg, with the cat sitting beside her looking confused. It took nearly 2 hours before she could reach her phone on the nightstand to call 911. 2 hours on a cold floor, alone, with pain she described as unlike anything she had ever felt in her life. When I met Dorothy in the ER, what stayed with me wasn't the fracture itself, it was what she said. She looked at me and said, "I've been getting up like that my whole life, Sarah. Why did it have to happen today?" That's the question I want to answer, for Dorothy and for every patient I've met who asked the same thing. The answer is, our bodies change slowly, quietly, in ways we don't notice until something forces us to. Nobody wakes up one day and suddenly becomes fragile. It happens year by year, month by month, like pages thinning in a calendar we forgot we were reading. The reflex of jumping up quickly that Dorothy had done for decades, perfectly safe at 30, perfectly safe at 40, had quietly become something her body could no longer keep up with. And that morning was the morning her body couldn't follow. Dorothy's story, thankfully, had a reasonable ending. She had surgery, she recovered, and after months of working with a physical therapist, she was walking again. But there's another patient I'll never forget, because his story showed me more clearly than anything else that the real consequences of a hip fracture go far beyond the broken bone itself. His name was Robert. He was 78 years old, living in Phoenix, Arizona with his wife. Robert had been a carpenter. His hands still had that quiet precision even in his late 70s. Every morning he was up before dawn to brew coffee, sit on the back porch, and watch the yard come to life in the early light. A ritual he'd kept for over 40 years. The morning it happened, his phone rang while he was still half asleep. He thought it might be his daughter calling from out of state, and he jerked upright too fast to catch it in time. He fell right beside his bed. His wife was in the kitchen making breakfast. She heard the sound and ran in to find him on the floor, pale, unable to get up. Robert had surgery for a hip replacement. Medically, the procedure was a success. But what happened after that is what I need you to really hear. It took him nearly 4 months to walk with anything close to his old steadiness. During those 4 months, Robert couldn't get out to his garage to work on the woodworking projects he'd spent his whole life doing. He couldn't drive himself to the hardware store or visit his friends. He couldn't sit down or stand up without someone helping him. A man who had built things with his own hands his entire life, suddenly needing help with the smallest tasks in his day. He said something to me at a follow-up visit, very quietly, almost to himself. "The bone healed, Sarah. But feeling like I can take care of myself, I'm not sure that's ever coming all the way back." That stayed with me. Because that's what I want you to truly understand. A hip fracture at this stage of life isn't just an injury. It can be the beginning of losing the independence you've spent a lifetime building. And nothing is more heartbreaking than losing that because of one morning, one rushed moment, one habit that felt completely harmless. So what do you do about it? Does this mean you have to feel afraid every single morning when you get out of bed? No, absolutely not. The good news is that this is one of the most preventable things I've come across in nearly 30 years in this field, and it costs you nothing. No equipment, no prescription, nothing to buy. I call it the 3-step morning rule. This is exactly what I tell every older patient before they leave the hospital. Not because it's complicated or medically sophisticated, but because it's simple enough for anyone to do. And it genuinely works. Step 1. When you wake up, whether it's the alarm or the urge to use the bathroom, don't get up immediately. Stay lying down for about 10 to 15 seconds. During that time, gently move your feet and hands, like you're waking your body up slowly from the outside in. Flex and extend your toes a few times. Rotate your ankles softly. This reactivates the pump system in your legs and gets blood moving upward gradually before gravity has to handle the full weight of your standing body. Step 2. Slowly shift to a seated position, letting your legs swing down over the side of the bed, back straight, hands resting lightly on the mattress for support. And don't stand up yet. Sit there, breathing normally, for about 30 seconds. I know 30 seconds feels like a long time when you need the bathroom or the phone is ringing, but that is the most important window in this entire process. It's when your blood pressure has a chance to adjust after the first positional shift, from lying to sitting. If dizziness is going to happen, it typically happens here. And here, you're in a safe position to handle it. You're sitting on the bed, not standing in the middle of the floor. Step 3. When you feel steady and ready to stand, find something to hold onto first: the bed frame, the edge of the nightstand, or a grab bar if you have one installed, and rise slowly, without rushing. Once you're fully upright, stay still for 5 to 10 seconds before you take your first step. Make sure you feel stable. No dizziness, no sense of the room shifting. Only then do you start moving. The 3-step morning rule adds less than a minute to your morning. That may be the most valuable minute of your day. I've shared this with so many patients over the years, and I've had people come back to follow-up appointments and tell me that the morning dizziness they'd been writing off as just part of getting older had noticeably improved. Some told me they couldn't believe such a small change made that much of a difference. Beyond the 3 steps, there are a few other things worth looking at to make your mornings safer. Things I've noticed in the homes of older adults that are surprisingly common oversights. First, make sure there's enough light the moment you open your eyes. A significant number of falls happen because someone gets up in the dark and steps into something they couldn't see. A small nightlight, or a motion-activated light on the path between your bed and the bathroom, can make a meaningful difference. Second, if the bathroom is more than a few steps from your bedroom, consider placing a sturdy chair or grab bar at a midpoint along the way, so you always have something to reach for if you need to pause. Third, if you're waking up multiple times during the night to use the bathroom, that actually makes your nighttime fall risk higher than your morning risk in some cases. Because at 2 a.m., you're coming out of deeper sleep, your reflexes are slower, and the lighting is worse. If that's a regular issue for you, bring it up with your doctor. There are often straightforward options that can help reduce nighttime waking that many people never think to ask about. Now, I need to say something important, and I want you to hear this carefully. If you regularly feel dizzy, lightheaded, or unsteady when you stand up, even after applying the 3 steps I just described, please don't brush that off or assume it's just normal aging. That's a symptom worth discussing with your doctor, especially if you're taking blood pressure medication, diuretics, or several medications at once. Your doctor may need to look at your dosage or the timing of when you take your medication, but that is your doctor's call to make. not something to adjust on your own at home. I'm not a prescriber, and I would never tell you to stop or change any medication through a video. What I can do is help you recognize when something deserves a conversation. And the conversation to start is simply this: Doctor, I've been feeling dizzy when I stand up in the morning. Is that something we should look at? That's a simple question, but the answer from your doctor could change quite a lot. I want to close with something I've come to believe deeply after nearly 30 years in this work. So many of my patients, looking back on what happened to them, say they never thought their body had changed, because that change happened too gradually to feel. You don't wake up one day and suddenly become fragile. It happens year by year, quietly, while you're busy living your life and assuming you're still operating the same way you did at 40. And that assumption, completely understandable, entirely human, is sometimes exactly what turns an ordinary morning into a dangerous one. But you don't have to overhaul your life to protect yourself. Sometimes all it takes is changing the first 15 seconds after you open your eyes. Dorothy, Robert, and so many others I've cared for in the ER, none of them thought that morning would be any different. But if someone had told them about the 3-step morning rule before it happened, their stories might have ended very differently. That's exactly why I made this video today. Now I'd love to hear from you. Do you ever feel dizzy or lightheaded when you stand up too fast, in the morning or any other time of day? Leave me a comment below. Tell me how old you are and where you're watching from. And if you have an older family member who lives alone, please share this video with them. A minute of your time today might protect them on a morning neither of you can see coming. If this video was helpful to you, please subscribe and hit the notification bell so you don't miss what's coming next. In my next video, I'm going to walk you through 6 warning signs that your body often sends out before a serious fall happens. These are subtle signals that can show up weeks or even months before an accident, and very few people recognize them, including the people closest to them. You don't want to miss that one. I'm Sarah. I'll see you in the next video. And please, take good care of yourself, because you deserve to live these years as safely and as fully as possible.